sitting or laying on your back in the MRI tube isn't necessarily going to tell us how it's going to respond in a game situation or even in a training situation. So if under, say, ultrasound, and we start to load the calf, load the Achilles, if we start to see this fraying start to happen, it might not be fully torn. That's just going to put us at a higher risk for especially that dynamic eccentric loading. Because there's a concept that I think we might have talked about previously, but it's called reversal strength. So whenever we go through a movement, say just a bicep curl, right? So if we go to kind of lift the weight, as we lift the weight, we're going through that concentric contraction. And then as we lower, there's basically a bit of a pause, and then we start to lower. So it's where the muscle transfers from like concentric to eccentric. There's kind of that transfer between. So in the case of these Achilles tears, they're going into this eccentric lengthening, but they're never responding with that concentric to kind of reverse the movement, right?
Yes.
So the eccentric moment just keeps happening until the tissue breaks. So whether that's neurological fatigue, whether that's tissue fatigue, whether that's tissue capacity, tissue architecture, like there's a lot of reasons why that might be happening. But as we see, the only way that they're typically addressing this is just through rest. Just stop using it for a short amount of time.